Welcome to True Out Tuesday, and the truth will set you free. Okay, when you're looking at this, pelvic pain and pudendal nerve pain. Pudendal nerve, you're going, I don't know what that is, unless it's involving in you. When we talk about S2, 3, and 4, helps everything. This is a massive, massive crime that's going against people. But we're going to go over the problems associated with it, the solutions associated with it, the most common missed solutions. But does anyone remember the Matrix, where you had to take the red pill and you would be exposed to truth that you were not familiar with, and blue pill, you could go back into the darkness and move up to Seattle? Well, this is happening. Okay, right now, Facebook said it's going to ban anti-vaccine ads. And I don't know what anti-vaccine ads are, because if you question the religiosity of this, you're done. The Defender, and I encourage you to look at this, because this was brilliant. Brilliant. I mean, back in the old days, when I disagree with what you say, but I'll fight to the death for your right to say it. By God, that's American. And that should be the world. We should have I don't know what we call rights that couldn't be separated from you. We could call them inalienable rights. Okay, and we could put them in a constitution and follow it. It'd be cool. He goes into that. Now, here's some of I've been producing videos for about 12 years that I monetized them about 9, 10 years ago in the ballpark. They demonetized them about 2 years ago, which is tough because it does take money to produce this stuff. But now they're deleting our videos, and it's hard to see in this. But the first one that was deleted was how to make people accept societal change willingly in rituals. So we talked about things that you can't really talk about, okay? And there's a lot of things that we have to work around, because there's things that you may have heard, but these things are not approved by the Ministry of Truth. So we have to develop, solutions in order to get around this. And, the tough part, think of, have you heard of this? Yeah. Raoult, one of the head guys in France, says it's really, really good. This one too. Okay, how safe is something that's rushed? I don't know. I'm thinking if we get a plane that's rushed to production, that's warp speed and doesn't really need to be tested, I don't think I'm going to get on that one. And then we can look at, say, little things, and it's challenging, because, over the last 12 years, I've been able to say stuff that's different. And it was actually kind of fun, too, because I'd be talking about how there's not good cholesterol or bad cholesterol. The cholesterol is actually elevated in signs of stress or inflammation, and it's used for tissue repair, and that the cholesterol-lowering medications actually cause cardiac damage, hardening of the arteries, and heart failure, which is all backed up by the science that I put up. And that'd be cool, right? Because then they put in an advertisement for the med, so that I was disrespecting. And I just thought it was kind of fun. But here's another one: coronavirus, and who is it killing and why are they dying? Okay, and the reason I'm bringing these up is because these were really good. It takes a lot of work to do this stuff. And so, but the Ministry of Truth says that you are not smart enough to discern what information coming at you, that it's better to have somebody else decide for you. Okay, and if you're okay with that, well, I wouldn't go here. We just started a new site, and we're trying to find different sites. And imagine if you build a fort, and the enemy comes over the first wall, you fall back to the next wall, then you fall back to the next wall. And that's what we're doing. Eventually, I have an apple cart I'm going to turn over, and I'll stand in a parking lot and yell. Okay, but this one, we have Extreme Health Academy. That's going. We've got good stuff there. Videos, everything that we post here is on there. Dr. John Bergman's site is good. It's less interactive. There's not a form on it. Library, LBRY. I encourage you to use that one. That one's a lot easier to use than BitChute or Brightcom. And a lot of our YouTube videos are put there. I'm trying to get all the deleted ones because the one on rituals will blow your mind. It will really blow your mind. Because if you have questions at how a government agency can judge you essential and you not essential and tell you can work and you can't work, why that is, why that actually happened. But the cool one is the Dr. B VIP site. And that's one that they can't censor. That's the one where they got to actually, have a red dot on you and, take you out. So, because they can't do this, because it's going to be a private site. So that's going to be coming next week. But let's look at pudendal neuralgia, because even though this is something you might have never heard of before, unless you've had massive pain. I mean, imagine if you sat and you had burning pain right between your butt cheeks. I mean, just your pelvic floor. You can't stand long. You can't sit long. You can't move long. I mean, just massive pain. And then bowel and bladder incontinence. There's tons of symptoms. But now pain during sex, frequent urination. And they're talking about there are no imaging studies that diagnose pudendal neuralgia. However, MRI and CT scan help to exclude other causes of pain. Physical therapy is the first line of treatment. Now, I'm going to show you that this approach is not only completely not effective. I mean, there's some people that can get some relief, but it's not going at the source of it. Now, they're saying, again, the pudendal nerve, pudendal neuralgia. Let's look at this. Okay, we're looking at the S2, 3, and 4. So the nerves that come out of this area here that come in and supply this like trampoline on the bottom. And I actually read one of the medical sites, they said, yeah, it's next to the tailbone. We do not have a tailbone. This is called the sacrum. Okay? We don't have tails. Okay? I mean, okay, so this is called the sacrum. And the reason is because it's a three-sided bone. They thought it was Father, Son, Holy Ghost, and that was the case that held the soul. They came up with this, and that's how they named it. So sacrum's a hell of a lot cooler than tail. But that nerve comes out of here and supplies that. So this means pelvic insufficiency, bowel and bladder incontinence. So when you see those commercials, I got this diaper now that works really good. I can play tennis with it. It's like, good God, find the problem. Of course, they're saying cyclist and things, because when you're sitting on this bone here. It's called the ischial tube, and that can destabilize the pelvis because sitting is really not that good for you. I'm going to show you a couple of exercises to turn sitting into healthy. But again, the brain is up here. The pain and symptom is here. The nerve comes out of here. Now, does it matter if you do anything else to the body? Do you think that might be affected there? Yeah, not in the medical world. Okay, so we're talking common sense and medical world. So they're saying diabetic neuropathy, trauma of the buttocks, excessive sitting, thickening around the ligaments, bony formations, all of these different symptoms, but they're not looking at the overall body. Now, the therapies involved, physical therapy, specialized in pelvic floor, so they'll be doing massages, electric stim, muscles that are not responsive to physical therapy. That means you can't stretch it because it's really hard to stretch that area. Okay, you inject the second most deadly toxin on the planet, botulism. Okay, hoping to hit the nerve that deadens the floor. Now, the floor, the pelvic floor there, the peritoneum, this is also bowel and bladder incontinence. So if you're deadening that, you might lose some feeling and some, function. Of course, you can drug it, gabapentin, pregabalin, tricyclic antidepressants. Now, you might say, well, why would you give an antidepressants knowing that caused depression and anxiety? Well, because if you have pain during sex, sexual dysfunction, and you bowel and bladder leakage, you are not a happy camper. So how do you assess it? Because obviously, if people are assessing it through symptoms, they're missing something. Because in all of this stuff, all of this stuff here, I do not see why, where it's from, what trapped it, other than, direct trauma of a childbirth or a car seat or bike seat or something. What are they missing? Why is there such a plethora of this around the planet? Well, this is how you're actually going to find the problem. First, you got to look at the entire body, because it's obvious to me, and the 30 people of common sense in this world, okay, that was a poll. You guys do have common sense here. Everybody else is crazy. So when you look at this, you can't have a symptom here and not look at the rest of the body. And I'm going to walk you through this because I know that's a bizarre concept to look at the entire structure. It's called holistic. Okay, so look at the whole body. You might want to take bending films, which was really nice because then you could identify problems. Full body thermography would be cool because you'd identify areas of lymph flow, stagnation. Heart rate variability would tell you if they're in a stress state, because we're talking bowel and bladder, pelvic function. That's also a function of the parasympathetic nervous system, a lot of it. How do you correct it? You don't correct it by eliminating the symptoms. You don't correct this by shooting it with botulism toxin. You got to look at the physical, chemical, emotional stress. These people can't sleep good. You got to change the sleep. There's an emotional component. You got to fix that. There's a structural component. You got to fix that. You've got to clean the blood. If somebody's been in a stress state for a long time, you have to address everything. It's mind-bogglingly stupid that people miss this. Okay, now this is a patient. We're going to call her Madonna. Material girl in a material world. No, this gal's cool. Okay, I mean, look, she's amazing. Okay, so when we're looking at this, that picture in the middle, of course, it doesn't show up there, but the picture in the middle is her standing up straight. Now, I want you to look at this, and can you imagine, just imagine that you smoke so much weed that you're not going to look at anything above the pelvis, okay, or you're that ignorant, okay, because you're seeing that there's a huge lateral deviation. But what it might be hard for you to see, so we're looking at a spine that is bent off to the side like this. From this picture, we don't know what's going on with the spine above it. We don't know if there's a reverse curve or loss of curve in the side view. We're just looking at this. Now, what you might not know is that this right here is the sacral iliac joint. It being white on there means it's inflamed. Now, there's no muscle that crosses the back half of this. So when I'm looking at this static x-ray, we're looking at inflammation of the sacral iliac joint. That means her gait is going to be off. So that means that if you have a lumbar that's bent like this and you try and fix this or shoot it with botulism toxin or whatever, do some nerves, but don't address anything else, do you think that you're going to get that person better? No or no? Yeah, I've always done the yes or yes, so let's try something different. So how you do this, you got to bend her. You got to bend this person off to the side. Now, the way discs are supposed to work, they're supposed to open up like a fan, where they're narrow on the concavity, wide on the convexity. But you'll see on some of these that some of those discs are not. They're switched or twisted. And that means it's a dysfunction. Now, that's a dysfunction of biomechanics of movement. You could call it a slip, bulging, or herniated disc. Those aren't really accurate terms because this is a disc dysfunction. It's communicating to the brain differently. Now, this is actually what the person looks like. I mean, without skin through an x-ray, which is actually really nice looking. But, but look at this. Okay, we're looking at a leaky gut. We're looking at thoracic distortions. That's the side view of her low back, and the side view is looking at this way. Now, the discs should also be narrow at the back, wide at the front. What you're seeing there on the before picture is two reverse discs right above the sacrum. Now, this might not show up. It might show up on an MRI scan because MRIs aren't really accurate and inflammation distorts it and body position distorts it. But it does show up nicely on a weight-bearing stress x-ray. The film next to that, on the right-hand side, the after, shows that the disc used to be reversed and now they're not reversed. But what I want is to explain this to you, and you got to pay attention, that just that little bit of difference That being a reverse, massive pain, can't sit down, can't do anything. This, she can go shopping. South Coast Plaza is her favorite place. She's also doing yoga. She's cool. Okay, in that much different. So it only takes a little bit to find the right spot. So we've got to find it. But if you don't know that discs, because imagine there's a lot of professions that don't think discs are alive and they don't regenerate. They don't understand that discs get their nutrients through imbibition or movement. I mean, this is, 2 years and you can see the discs start to regenerate. So when we look at this pelvis area, this is a martini glass. This is a male pelvis. A rounding area here where the ischial tubes are, that would be a margarita glass. That would be a female pelvis. So you could say, hey, yeah, that's a guy. Okay, now this has no muscle that crosses the back half of the sacroiliac joint here. It's only ligament. Now ligaments, you can't really strengthen. There's not fibers in there to contract. So this is a beautiful design. I mean, the more you understand anatomy and physiology, you're going to say, wow, somebody really did a good job. This was intelligent. I know. Christians out there are going, we told you. I know. Okay. So when you look at this, it's a good joint. But if you're sitting on this all the time, or if you've had a trauma, okay, that can destabilize this. So one of the key factors is to correct this and to stabilize the pelvis. But wait a second, let's think about Madonna there. You've got this. Now she's walking around with this. And that's an asymmetrical presentation. Her body is not evenly distributed over the pelvis. So if you don't address the thoracic deviations or lateral deviations or forward head carriage or any of that stuff, and you are still in this type of a mindset, okay, pain here, shoot there. Not pain here. Why? It requires something more investigative or an appreciation that the body is intelligent. So bladder control, sexual dysfunction, leg pain, walking pain, foot pain, knee pain, all of this stuff could be from the pelvis. Is it? Should we only take care of pelvises on people? No, because the pelvis is a perfect design. So what I want you to own, that for this thing to dysfunction is not a problem of this pelvis. For this pelvis to have a dysfunction, you have to have altered gait, flattening of the feet, altered knees. You have to have a distorted torso, something. It's going to be different on everyone. And we get people with pelvic pain, and I'm talking, it's been hurting for 10 years. We had this one guy, 12 shots in his groin, okay? And that's sensitive. I know, there's like 5 guys right now that would go, okay. He comes in here and literally, we gave him one of our exercises that I'm going to go over. This, we adjusted him, stabilized his pelvis, and he was pissed. 12 shots, and the shot worked maybe 6 weeks the first time, then it was like 2 weeks the next time, then they tried a different location, it didn't work at all. He was pain-free, but that's because they're looking in the wrong place. If you're thinking that muscles are the problem, muscles don't react on their own. I mean, it would be weird to just be here and have a muscle just react on its own. Oh, Sarah, my arm is just in spasm. Can you just shoot it with something? Okay, that sounds stupid, right? Okay, except when you get a person that says, oh, I got this chronic TFL, this tensor fasciitis just killing me. My glute is in chronic spasm. You understand? That doesn't make any sense. But what you're looking at, this joint is a perfect joint. And I'm going to say this a bunch because I want you guys to own this. Okay, this is a perfect joint. It only malfunctions if there's some type of dysfunction. Now you got the glutes over here. The gluteus medius is the main hip stabilizer for the opposite side. That means if you stand up and take pressure off of this side, okay, this side has to spasm out in order to stabilize it. So those muscles are going to increase in tone for a reason. You got one muscle that crosses the front part called the piriformis. So if you have been diagnosed with chronic piriformis syndrome, or this or that. I mean, the piriformis can go through a muscle, and that's super rare. And you're not going to get somebody that's 50, 60 years old that's lived their whole life. All of a sudden, it's growing through a muscle and needs to have surgery. Again, we're talking common sense versus crazy. It's like this person here with the kneecaps. The kneecap is supposed to be in the middle of that femur, and it's laterally deviated on that x-ray. So that means either the quadricep isn't firing correctly, there's something going on with the lumbar, but if you have, and I'm just showing the knee, if the knee is dysfunctional and there's even a slight change, is that going to change when your gait? If it does, it's going to change the pelvis. So can you see, there's no way in the world you can assess correctly pudendal nerve entrapment or pudendal neuralgia, okay, without looking at the whole body. And I couldn't find it. I couldn't find it anywhere in the medical literature. It's like, good gosh, guys. Piriformis, it's not, muscles do not react on their own. Critical thinking is missing in our world. Good God, it's missing in our world. We're going to shut down the whole economy, not pick up any food, and just print money. The only way that would work is if we could eat the money. Okay, so you can't. Eventually, you're not going to be able to buy stuff. So to think that a muscle is responding on its own without some other outside influence is stupid. Now, this is huge, okay? When you're looking, and I want you to get to this problem before it becomes a problem. If your big toe is leaning towards the other one, that does not run in your family, okay? Bunions don't run, okay? But this means that there's compromised nerve supply to it. And the compromised nerve supply comes out of the top of that pelvis area. So if you start to see a foot distortion, think of this. Is that person going to have a good gait or a funky gait? Funky gait. That funky gait. What's the first thing that's going to be negatively affected? The pelvis. So what happened first? The knee trauma, the foot trauma, the pelvic dysfunction, the lumbar disc problem, the falling off a staircase when you were a kid that distorted this, that created an uneven force loading? I don't know. But each person is different. You can't shoot everyone with botulism toxin or, some other type of insanity. And don't worry, ladies, sexy shoes like this do not cause bunion formation. Okay, they will tighten the calf, shorten the calf, but there's ways around it because guys like you in them and you feel sexy wearing them. So that's cool. Autonomic function is the key. When you're looking at this, it's not just the pudendal nerve. It's not just the pelvic floor pain. It's not the pelvic dysfunction. This affects your automatic nervous system, every part of it. This is resting, digesting, and repairing. This means that if this thing isn't working correctly, you're talking slow gastromotility, 1 poop a day, means your immune system is off. Sexual function, forget about it. Okay, it's called pointing and shooting or parasympathetic. It's not going to be working. So when you look at this, and again, I want you to start checking everybody's feet. If you see a pink hue to that, where you touch it and it turns white, okay, that means that there's some kind of excessive histamine released inside of the body. And I saw this. I'm going to bring up a patient who just broke my heart because she didn't like my personality, and I don't blame her. I don't like my personality sometimes. It's a little caustic, but this right here, when you see pink, that could be a leaky gut. It's a weakening of the immune system. It's histamines everywhere. It's going to be sinus issues. It's going to be inflammatory bowel disorders. It's something, but that's a big, big finding. And if you see the distortion of the foot, slow gastric motility, constipation, sleep problems, fatigue, anxiety, brain fog. When you're looking at a bunion, how could that be? Well, because the cerebellum, anytime you have a movement, you stimulate that cerebellum, that little tiny brain, and that brain controls the frontal lobe. How important is that frontal lobe? How about in schizophrenia, Tourette's, autism, Parkinson's, addictions, obsessive compulsive disorder? Okay, OCD, okay, Fauci, you betcha. No problem. We just got to keep away from everyone and wash our hands. Frontal lobe dysfunction, okay? And he could be in politics for years. Okay, so depression, bipolar disorder, all of this stuff, because this is the body adapting. So think of this. Does that mean that if you have a normal shape where you're curved from the side, straight from the front, you have normal stimulation of that cerebellum? Or you have loss of curve, reverse disc, some type of distortion. You have an abnormal stimulation to the cerebellum, and you're going to have an abnormal or a stress response. Does that make sense? It's not medication deficiency syndrome. This is the gal that I screwed up on. Okay, now when you look at her, there's a reverse curve in the neck. Okay, reverse curve in the neck, and she had symptoms in between her shoulder blades. But when you look at this, sure enough, there's a lot of distortions in there. And active people will get this. And people say, oh, I never had a trauma. Okay, did you ever swing on a swing when you were 6? Did you ever fall off a slide? These could be little traumas that you never even thought about. And I mean, I'll tell you, I'm talking to people and they're talking to me like this. No, I never had an accident. I'm like, buddy, you did. Okay, you really, really did. Okay, why do you say that? I feel fine. Okay, now, if I'm joking around and I'm saying, no, dude, you really had an accident, they might take offense. And so I've got to be better at my personal communication. But again, when you see that pink skin and you touch it in a kid, I mean, it's like, oh my God, this is really, really dangerous. And I didn't explain it well at all. Then we're looking at, again, S2, 3, and floor keeps the ding-dong off the floor. That's the mnemonic. But this is bowel and bladder incontinence. This is everything. I mean, if you're looking at a normal bowel or bladder pattern, one time a night, I don't recommend you getting up to pee at night. Stop drinking about 2 hours before. But if you have increased frequency, if you have an abnormal production, if you get that sense of urgency, you got to think of pelvic instability. And that's just one part. You got to look at why it's unstable. You got to look at why it's unstable, not that just the nerves are compromised. That doesn't make any sense at all. Again, parasympathetic nervous system, S2 to S4. That's S2, S3, S4, and that's the pudendal nerve. Ureteral gentle diaphragm. I mean, there's so many diaphragms in the body. You've got a breathing diaphragm. You've got a diaphragm inside of the skull. You've got a diaphragm in the back of the throat there that has this movement, this function. And this is why, if you're sitting, you can destabilize that. If you're constantly trying to touch your toes like that, that's not good. If you can put one leg up, okay, and stretch down, that is a good stretch because it'll stabilize the pelvis. But this is the area between either the penis and the anus. That it's like a spring. It's like a coiled spring, like a trampoline. Oh, and this also too. The psoas muscle, that big muscle that goes up on the lumbar, it attaches here, and it's a big meaty one that goes down in there. And that muscle, if it's a hip flexor. What else are they going to say? Oh, chronic hip flexor tightness. Okay, anybody want to say why? I would, because if you have a spine built like this, I'll tell you right now, these muscles are controlled by the sensors on the spine. And if you have a spine that is not straight, the muscles on the convexity are going to be contracting to straighten it up. You can't stop it. When you lean this way, the muscles on the outside right now are spasming out, and I can't control them, I can't relax them. They're slowing my descent. The muscles on the inside aren't contracting to lower me down. It's the muscles on the outside slowing my descent. So you have to not get away from looking at the tight muscle, tight psoas, tight this, tight that, and find out why. Now, drugs for pelvic pain and common drugs that also cause dysfunction. Contraceptives, okay, that decrease that synthetic estrogens, decreases testosterone, antihistamines. So if somebody has that pink skin, are they going to be taking an antihistamine? Yeah, because the doctor recommended it. Non-steroidal anti-inflammatories, this is for just about any pain. Antidepressants, just about any pain, even though the side effect is suicide, suicidal thoughts. Panic and anxiety drugs, okay? Again, the drugs cause symptoms they're designed to treat. Blood pressure medications, cholesterol drugs, antacids. That's nuts. The only way to correct this is to fix the problem. Okay, it sounds too simple, but if you have a spine that is supposed to look like this, and it looks like this with forward head carriage, what drug is going to fix this? What drug is going to cause an inflammatory response to have those discs regenerate and reposition so it changes proprioception and how the muscles fire? There is no drug. But we are in a psychotic world of symptom drug therapy. And why is it there? No one's asking the question. What's the cause of fibromyalgia? Unknown. Inflammatory bowel? Unknown. Depression and anxiety? Unknown. High blood pressure? Unknown. In the stupid world where you're treating stuff with chemicals, it's passé. You got to look at how it's there. This is how you correct it. When you look at the x-ray, on the right, you're seeing a lateral deviation. You cannot push it one way and then flip it over and push it the other way. Yeah. Push still hard till you find a pop and pray. They call it pop and pray. Okay? That's ridiculous. Okay, what we do is the patient is in abdominal suspension, so the pelvis is supported. The tummy is hanging in the air, so it's creating a negative pressure on the front. And then, if there is a lateral deviation, like that, then you're going to traction out and you're going to push this one this way. You'll push this one this way. I know, you want to say slow down. No, it's that simple. Okay, but here's the key. The muscles on the outside portion of the curve are contracting to strengthen it. And so what we have to do, we have to change the way the body views the brain. It's called proprioception. Because right now, the brain thinks this is normal. So what you have to do, you have to change the sensors on each one of these vertebrae. They're called mechanoreceptors. I mean, you got joint mechanoreceptors in the joint. You got the intrinsic muscles, the little tiny muscles that have muscle spindles. Those communicate. Even the ligaments communicate to the brain. You have to change that communication, change that proprioception in order to change the movement. So this is the hard part to understand. The bone is not out of place. It is not in place. We're putting it in the normal position and motion, getting the brain awareness. The position and motion changes that stimulus up to the brain, and then that causes the body to be normal. Okay, does that make sense? Because once you get that, you're down home. This is my daughter-in-law. I miss the heck out of her. She's now been in Poland for the last year and a half with my son. They live on the Czech border in probably the most beautiful area you've ever seen. It looks just like the opening scene of Sound of Music. It's incredible. These decompression tables, I don't like at all. Okay, because they pull it apart. They do, but they don't. You're not going to get a post x-ray, because if you're trying to fix this and you're just pulling it this way, you're not taking care of the lateral force loading. Okay, so it doesn't make sense to me. And then you're not changing the proprioceptive firing. You're not changing the mechanoreceptors or anything. So this is a couple of home exercises that you can do right now if you've got this pelvic pain. You can get foam piece that we have that's pretty dense, and the bottom of the elbow is where the bottom of this is going to go. You can also use a regular bottle, okay, just a glass bottle. Now this is filled with turmeric, cardamom, coconut milk, black pepper. This is the most powerful antioxidant. Vanilla, okay, cinnamon and ginger. So we're talking vasodilating herbs. This is amazing. And this has anti-inflammatory properties. It's incredible. And it's also homemade. Thank you. It's fasting today, but tomorrow I can do it. Okay, so if you got a chair with arms and you can distract, and if you're distracting while you have this foam piece behind you, you're going to have a force loading going from the back and force loading separating those joints. Simple, easy, nice. This is something that you're going to be using when you're flying, when you're driving, when you're biking, when anything, because we've got to turn that sitting into therapy. But this for just tractioning up And you don't have to push down too far, just so your butt lifts off the chair a little bit. So you're creating a negative pressure. And even if you're not putting this behind you when you're doing that, discs get their nutrients through movement. And so if you can induce a little bit of motion there, you're getting some fluid in. Now, trochanter support, really simple, easy. You can get these babies on Amazon. They cost around $10. Super simple. The way that you can decide whether you need one or not is have somebody squeeze your hips. And if that feels better, you're taking pressure off. If it doesn't, you might not need it. And how do you know how long you should wear it? When you put it on and it doesn't feel better, you're not approximating it. But also, we had a patient today that her pelvis was so inflamed that when she put it on, felt good immediately. Then after she was walking in it, it started to hurt. And so I said, look, take it off. It may take a couple of weeks, because think of this, think why it would work. So one, there's no muscle that crosses this. So the trochanter support, knowing that this joint is unstable, approximating it makes a heck of a lot of sense. Now, if it's inflamed and you bring it together, it's going to feel better, but then you start to use an inflamed joint and it's going to hurt. So take it off. Okay, but then eventually, typically people will need it maybe 4 or 5 weeks. Some people will need it 6, 7 months. It really is dependent on how much work we have to do to stabilize, to take the pressure off of this pelvis, which the pelvis is usually not functioning correctly because of either a foot, a knee, a lumbar disc, forward head carriage, lateral deviation of the rib cage. There's going to be some reason that perfect pelvis isn't functioning correctly. And even sitting like a cowgirl or a cowboy, if anyone ever remembers, you flip the chair around and you sit wide, because you bring the legs out wide, that approximates the pelvis and helps stabilize it. Now, a lot of people will prescribe Kegel exercises. And guys know what Kegel exercises are, because how many times have you written your name in the snow? I know it's Southern California. Sand, damn it. Okay, so, but it's when urine's flowing, you stop it. Okay, and that muscle contraction is the Kegel exercise. The weird thing is, if you have pelvic dysfunction and you've got S2, 3, and 4 not working correctly, you got an unstable pelvis, you've got compromised nerve supply to that area. So people are going to say, look, do Kegel exercises. Yeah, right. I've got no nerve supply. I can't do it. It'd be like saying, okay, go from here to here. Now go back. Come on, go back, go back. That'll drive you crazy. Try it at home. It's not easy. Okay, but so you try and do a Kegel with compromised nerve supply, it is not going to work. Okay, but the Kegels are fantastic. And you literally hold it for a count of about 5 to 10 and then relax. Hold it for a count of 5 to 10 and relax. Do several of those throughout the day. You're going to develop great control. Imagine if you had this kind of control in that pelvic area. Prostate massage. This is something culturally we have to get over. Okay, if you get, we're exposed to a myriad of chemicals that are estrogenic. A lot of pesticides are, prostates and being a male in America is, God, how can we make it? A prostate massage is really, really simple. You go in the rectum forward and then pull it down. Okay, in the rectum forward and pull it down. Simple, easy. There's plastic devices you can get. Just get that. But also, because in a lot of prostate issues, we recommend moist heat on there. Know that if you have a pelvis issue and you're putting heat on that area, you might not feel it. So make sure that you put, check it on a tender area of your body, make sure it's not too hot, but moist heat. You can see where the prostate is. It's right there. It's really, really close to the surface. And the heat penetrates about 2 inches. So that's one of the greatest things that any guy can do to maintain it. When you're sitting, you can change it into therapy by putting this up higher. You want it at the junction of the rib cage and low back. So when you're sitting up straight, the bottom of the elbow is the bottom of the roll. So it's up right at the thoracolumbar junction. Now here's the key. You put it in there for 20 minutes, take it out for 10 minutes. 20 minutes in, 10 minutes out. Why? Well, we're not talking about this right now. Okay. I'd like to, but we'd get censored. But let's use this paper to demonstrate the plastic elastic deformation curve that human tissue goes over. If you bend this and let go of it, it retains its original shape. That's elastic. You put it under enough force loading for enough time, it retains a new shape. Okay, so that's the plastic deformation. So you can cross the plastic elastic deformation curve in human beings by putting it under pressure for 18 minutes. I know what you're thinking right now. That's why they say only 20 minutes a day of doing this or that. No kidding. They're all doing the whole biomechanic. Yeah, that's it. 20 minutes a day. That's what you need in order to change it. This one, we're going to stick it up a notch. You're going to go 20 minutes in, 10 minutes out. 20 minutes in, 10 minutes out. The whole time you're sitting for forever. Okay? That way we turn sitting into therapy. This is the worst exercise you can do. It will feel amazing. It will feel romantic. Because when you got pain and you have a normal curve in the back and you lay down and you pick your pelvis up, all those holes on the back of the vertebrae open. However, all the discs are reversed. So you're going to have to call the paramedics to get you out if you're on a cold floor. This is not a good exercise. What we'll do is do extension exercises, the exact opposite. We also have technical materials like this. Why? Because when you're working on a no, it's not a 4x4. This is a medical device. I've stamped it. Hey, look, it works. Okay. So you're going to be stretching this because why? What happens? If you're looking at today's kids and people that are damaged with the brain, you're going to see a lot of toe walkers. Okay. That is altering the pelvis, going to cause all sorts of autonomic damage, but that is part of their brain. And when you look at teenagers, they will not be able to put their foot, and that's me demonstrating when I had funky shoes. Okay, the knee should go over the toe. That's just normal. I mean, granted, I look like a dancer, but no, that's normal flexibility. That's not like yoga Cirque du Soleil stuff. And so you hold that for 1 minute twice a day because you've got to. When you're talking pelvis, if you're not paying attention to the gait, you are never going to stabilize that. Pumping the leg is fantastic, but also we'll do pumping as a cross-crawl exercise to get both halves of the brain to fire off. Why is that important? Because when you get a body that should be straight up and down, but has lateral deviations, this is a proprioceptive problem. It means your brain's viewing the body in space incorrectly. That means that this right here is always going to have an incorrect force loading on one side or the other, always. And the only way you identify it is by looking at why that pudendal nerve is a problem. Because people aren't even going to look at the rest of the body in crazy world that we're living in. They're not appreciating that the body is intelligent or gives symptoms for a reason. I mean, basic tenets of what we run our office on. Moving lymph, this is vital. But if you have an unstable pelvis, this is actually a good exercise, but use the trochanter support. Just stabilize it. It's so simple. The ball exercise, one of the best things around. But when you're exercising and you're in an acute state, wear that trochanter support, and then everything will be okay. Anti-inflammatories, okay? I mean, rip open a coconut, put it in a blender, put it in here, turmeric, I mean, just stuff. There was an old guy that said, let food be your medicine and medicine be your food. I mean, it's really smart. Duh. Okay, so this is literally how you identify and correct the problem. One method. There may be another, but if the method involves just looking at the area of symptomatology and doing an intervention without addressing the cause or even thinking about the cause, you need to find another doctor. Okay, even if you got to fly 10,000 miles or 12. I know. So here's 7 questions to find a corrective chiropractor. It doesn't work in Bangkok, but you can find somebody. Do you take x-rays? Why? Because you would like to see. I just had a patient today that says, Doc, do they have to go through this whole thing, the exam and everything? Or can you? I said, no, bring somebody that you don't really like and we'll just find a tender spot and push till we hear it pop. And that's what they did. They laughed and giggled and they said, no, you probably like him. Plus, if we do that, that's bad karma. Just bring him in. We'll get him checked. They'll be okay. Do you take post x-rays to document the changes? That would be nice. Okay, do you mark x-rays so you're not just taking them to bill insurance? Can you reverse arthritis? If you do this, you understand that this abnormal force loading is going to change and remodel the joints. This will change the force loading and the joints will remodel to the new position. That's called reversal of arthritis. Do you work on post-surgery patients? That's a skill level. And you work on elderly and you work on kids. Again, skill levels. Now, knowing that censorship is very, very common and very, very popular, I mean, there's some things that I'd like to mention that would be fantastic to cover, okay? And this would be great supplements, okay, to facilitate the regeneration of tissue. So let's support groups that protect our freedom, okay? Because I do like the freedom. The Millions Against Medical Mandates, if you think that you have enough intelligence to decide what's done to your body, join a group of like-minded people. If you don't want that burden of deciding what's for you, just look at the Soviet Gulag, Russia, North Korea, or America now. Medical Freedom Pack, I'd support them, but this is going to be exciting. Pretty soon, I mean, start checking out our stuff on Library. We're going to put all the deleted videos on there, or the censored videos. The Ministry of Truth, I don't think is aware of Library right now. And next week, we're going to have the announcement on Dr. B VIP. What we're going to do, we're going to have the talks in 2 20-minute sections. The first one is going to be the problem and solutions that we can talk about. And the next part is going to be solutions that would be censored. I, honest to God, never thought I would ever say something that ridiculous, until I moved to, Russia or North Korea. Next week, we're going to talk about the real stuff: addictions, alcoholism, okay, violence, abuse, sadness. How do you get somebody that looks at alcohol as the only key, or drugs as the only key to survive in this psychotic environment? We're going to go over the solutions and the causes. Okay, and this could be loss and everything else next week. Okay, thank you very much.